Hello, my name is Maxine. I'm going to be performing assessment. Let's take a look around the room. My patient is here. My supplies is here. I have a chair here. Okay, again, my name is Maxine. I've washed my hands. I'll have a seat next to my patient. Can you please, you have something on your eyelash.
If you turn that turn it straight. It will see my foot and stuff like that.
It's okay.
Then you turn it straight up. Make it.
Okay, I think that's good enough.
Perfect.
Okay. Can you state your initials
DB
and your date of birth?
4986.
Okay, so I'm going to start with a visual inspection and palpation of the arms and the hands. I'm looking at the skin, looking at the fingernails and the nail beds. I'm going to look at the legs. I'm looking at the toenails and nail beds. I don't see any irregularities or any abnormalities. I'm going to inspect the scalp and hair. I'm looking at distribution and for any lesions or irregularities, which I don't see any. Okay, at this time, I'm inspecting the eyes. I'm going to palpate the lower lids, the upper lids. I'm looking at the outside of the eyes. Can you follow my finger, just your eyes, don't move your head. Checking extraocular movement. Okay, good, thank you. I'm gonna check peripheral vision. Look directly at my nose, don't move your head. Tell me how many fingers I'm holding up.
2. 1.
Nope. Try again.
2. 3. 1.
Okay, excellent. Gonna examine the optic disc. I'm looking at the optic disc. There's sharp margins within normal limits. That's expected. And the same thing with the right eye. Thank you. To test for visual acuity, I could use my Snellen chart. This is small. Depends on the size of your Snellen chart. This says for the patient to stand 6 feet away. Would have them cup their eye so they're not putting pressure. And this would be for the eye I am not examining. And their acuity would be based on the numbers listed depending on how far down they could go. I would do one eye at a time and then both eyes together. I'm going to assess the pupillary response with my pen light here. Okay, pupils equal, round, reactive to light, and accommodating. I'm going to palpate the frontal sinuses. Any pain, sir?
No.
And now the maxillary sinuses. Any pain?
No.
Okay, excellent. I'm going to inspect the ears, the outer ear. They're symmetric. I don't see anything abnormal. I'm gonna look at the inside of the ears, assess the tympanic membrane. Excuse me. It's pearly white. And the cone is at 7. The cone of light is at 7 o'clock. Tympanic membrane over here is also pearly white, and the cone of light is at 5 o'clock. It's within normal limits. Inspecting the neck, I don't see any TMJ. I'm going to palpate the temporal arteries within normal limits. I'm going to palpate the carotid artery one at a time. I'm going to auscultate the carotid artery. I'm checking for TMJ. Open and close your mouth, please. Your jaw. Yep, close. Good. No clicking. Note it. Can you stick out your tongue? Lift your tongue up, down, side to side. Okay, oral mucosa is within normal limits. I'm going to visualize the inside of the nares. Will you hold one nostril closed and blow? And now the other? Okay, so be patient. Will you close your eyes? I'm gonna let you smell something. I want you to tell me what it is. Can you smell
Mint.
that? Yes, thank you so much. You can open your eyes. Okay, I'm going to have you stand up, please. I'm going to step behind you, lift your head up. I'm checking the thyroid. I don't feel any abnormalities. Have a seat, please. Okay, moving on to the, before we move on, to check gag reflex, I would use a tongue depressor, stick it to the back of the throat to elicit a cough, which would be a positive gag reflex, and that is expected finding. Next, I will check the pulse oximetry or O2 sat with a finger probe, looking for my percentage, which will let me know what the oxygen saturation is. At this time, I'm going to check Firmicus. Can you say coin?
Coin.
Okay. Also, while doing that, I noted that his chest has symmetric rise and fall. I'm going to do the same thing on the back. Say coin.
Coin.
Okay. At this time, I'm going to auscultate. Can you say 99?
99.
Every time I move it, I'll need you to say 99.
99. 99. 99. 99. 99.
Okay. Actually, can I have you sit right here and I'll listen to the back? Same thing, say 99 every time I move it.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. At this time, can I have you sit over here? Let me see you, okay? Yeah, okay. Oh, pardon me. I'm just checking percussion. At this time, I'm going to have you lay with your head on the pillow over there, please, and your feet closer to my side. Thank you. I'm going to be just assessing for JVD. I'm looking for any abnormalities. I don't see any at this time, and I'm going to auscultate the 5 heart sounds. I'm going to start first with my diaphragm, second intercostal space on the right, moving over to the left intercostal space, second intercostal space on the left, third intercostal space, fourth intercostal space, fifth intercostal space, mid-clavicular. I'm going to listen again using the bell of the stethoscope. morning, Mr. EB. I'm gonna have you change positions, put your head over here and your feet over here. I'm going to check your pulses bilaterally. First here, brachial, strong and equal. Gonna move down to the radial, strong and equal. I'm gonna check here the popliteal bilaterally, strong and equal. I'm gonna go here to the posterior tibial, strong and equal, and then the dorsalis pedis, strong and equal. Okay, at this time I'm going to auscultate your renal arteries, femoral arteries, and your renal arteries, iliac crest arteries, and the femoral arteries. At this time, I'm going to assess your abdominal area. Gonna auscultate first, starting with the right lower quadrant. I'm going to percuss. I'm going to lightly palpate. In order to do deep palpation, I would go 1.5 to 2 inches deep. To palpate the liver, I would be looking in the right upper quadrant and pressing deeply, moving upward. If the liver is enlarged, you will be able to feel it and you would start to feel the borders. In order to palpate the kidneys, you would put some pressure here in the back and deeply palpate. And the same thing for the opposite side. And in order to palpate the spleen, you would do deep palpation, and that would be on the left upper quadrant. At this time, I'm going to check for a CVA tenderness here. Okay. At this time, I'm going to move on to the musculoskeletal assessment. Can you lift your arms like this? Good. Can you bring your ear to your shoulder, and then the opposite side? Go down like this. Like tilt. Tilt your head. Tilt. Okay, and then you did this. Okay, good. Can you bring your knee toward your chest? Good. And now the other one. Can you bring your leg out laterally, so to the outside of you? Yes. And now the other one. Good. Can you move your wrist around? Can you bring your toes down like you're pressing gas pedals and then back up? Good. And then back up? Good, good. Okay, now I'm gonna test your strength. Oh, can you shoulder shrug as well? Good. I'm gonna put my hands here, same thing, shoulder shrug. Good. Bring your head toward my hand, yeah. And then the other. Okay, perfect. Can you bring your forearms up? Push me away, pull me. Okay, good. Can you bring your knees towards your chest? Good. Now push, yep, same thing, other one. Pull. Push. Okay, good. Can you bring your leg out against my hand and then in? Good. And then out. Oops. Sorry. And then out. Okay. Can I have you bring your leg up over across yourself? Like just move it over so I can see that you can move it good. And then across. Yes. And now the other way. Okay. Perfect. Thank you. Okay. Can I have you squeeze my fingers? Good. And then I'll have you push and then bring your toes towards you. Okay, just making sure, don't want to miss anything. Okay, at this time I'm going to check your tendons, deep tendon reflexes. Oh, here we go. Come see it. All right. Start here, relax your arm. Start here. Okay, good. Go here. Good. Good. Now have you sit up and have your legs to the floor. Good. Try to relax. Okay, good. Okay, at this time, can I have you stand up, please? I want you to bend at the side here and then the other side. Good. Reach forward. Put your bend at the waist. Good. Can you lean back? Okay, good. All right. Have a seat, please. I'm gonna go over your neurological. Can you tell me your initials?
DB.
What city are we in?
Springfield.
Can you tell me the date?
10/13/22.
Okay. Can you tell me what you did for your birthday last year?
I had a birthday party.
Okay. I'm gonna name 4 items. I'll need you to repeat them back to me. Chair, table, plate, bowl. Can you repeat it back to me now?
Chair, table, plate, bowl.
Okay. Can you count by 20s to 100?
20, 40, 60, 80, 100.
Okay, perfect. Can you repeat those items back to me?
Plate, chair, table, bowl.
Thank you. Okay, can I have you follow me and do this really quick? Okay, now with the other hand. Keep your, straighten that palm out, yeah? Okay, good, perfect, okay. Can I have you, close your eyes and tell me if it's a dull pressure or a sharp pressure.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, good. You can open your eyes. Okay, I'm going to have you close your eyes. I'm going to write a letter with my finger on your hand. I want you to tell me what letter it is. Close your eyes.
O. A.
Okay. Can I have you clench your teeth? Okay. Lift your eyebrows. Open and close your eyes. Okay. Open your mouth and say ah.
Ah.
Stick your tongue out. Okay. Good. Good. Okay. That's the cranial nerves. Can I have you walk? I want you to stand up and walk. Okay, good. Can I have you walk on your heels? Okay, can I have you walk heel to toe? Good. And can I have you walk on your tippy toes? Okay, good. Will you have a seat? Put your legs up, back, put your back there. I want you to take your heel and rub it up and down your shin, up to your knee. Good. And now the other one. Okay, good. And then one thing that I want to go back to, will you sit up?
Yes.
Actually, I have this paper for you. Will you read it and follow the directions on the paper?
Take paper.
Okay, good. Thank you. Will you close your eyes? I'm going to put something in your hand, and I want you to tell me what it is based on how it feels.
Key.
Okay, thank you. And then I have another item here.
Q-tip.
Okay, perfect. Thank you. You can open your eyes. I think that concludes our assessment. Thank you very much, Mr. DB, for your time.
No problem. Thank you.
Okay, you're welcome.